Hello, so my name is Patel and I work for the Alzheimer Society, and I'm doing a joint presentation with Nikki from the Bromley Dementia Hub. And we're just going to give you a very quick overview of things that are happening in the field of dementia and the work that's ongoing. So I'm the Regional Public Affairs and Campaigns Officer at the Alzheimer Society. I cover the whole of London, so Pan-London. And I was just going to give an overview of some of the issues around dementia, some of the national campaigns that we're doing, some of the national programs that we're involved with, and how you can get involved as well. So firstly, I just wanted to give some highlights around what is dementia. Sometimes people don't have the basic grasp of what it is. Dementia is an umbrella term which covers over 100 different types of the condition, including Alzheimer's. It's not a natural part of the aging process, so it's not necessarily the case that everyone who gets old gets dementia, and equally, there are people living with dementia who are much younger, sometimes even as early in their 30s and 40s. And there isn't a cure for dementia, and sometimes the general public think, oh, well, there's nothing that can be done. But actually, there is a lot that can be done in terms of supporting people to live well with dementia. And so it is worth people getting a diagnosis, because they can access all those support services which do enable you to live well with dementia. And the other thing is, no two people experience dementia in the same way, so it affects everyone differently. So what we often say is that if you know one person with dementia, you know one person with dementia, because it impacts very differently. There are a couple of statistics I wanted to point out as well. In terms of dementia as you get older, it does, impact more as you do get older. So 1 in 14 people who are over 65 have dementia, and 1 in 6 people who are over 80 have dementia. And often people think, well, dementia, that's people in care homes, but actually 2/3 of people living with dementia actually live out in the community. It's only 1/3 that live within care homes. And it is the leading cause of death amongst women. So those are the ones I wanted to highlight. Just last month, the Dementia Action Alliance relaunched. They updated and revised their dementia-friendly hospital charter. So that was updated last month, and it now has a section around volunteering, which is the new aspect of it. What that charter is, it's a kind of guide to enable hospitals to create a dementia-friendly environment, both for people living with dementia and also their families and carers. And the Minister for Care actually wanted every single hospital to commit to becoming dementia-friendly. And it's a really important initiative to improve the care that patients with dementia receive. And so it's got sections on staffing, on assessments, care, environment, and volunteering. And it's just a really good tool to use in terms of seeing how, if you're working in a hospital setting, how your hospital matches up to some good practice guidelines. So I've got a few copies that you can browse through on the desk, but it's available online and it's free. The other thing I wanted to talk about was our main campaign at the moment. So in May, we published this, which is called Dementia, the True Cost, Fixing the Care Crisis. And it was based on a lot of extensive work that was done at the start of the year, working with people affected by dementia and having a whole host of listening events to see what was important to them. And we basically highlighted that the social care system is obviously struggling under a lot of pressure. Lots of people living with dementia aren't really getting the care and support that they need to enable them to live well. And many were actually using up their life savings just to get the basic care they needed, because the average cost can actually be up to £100,000, which people don't even realise. So that's what we estimated as a cost. And we actually we're calling for action in this report on 3 key things. Firstly, in terms of cost. Obviously, if you have a health condition, you get treatment free on the NHS free. but social care is not covered by that. So we were actually saying that the government should invest in social care so that most people can actually get the treatment and support they need free at the point of use. We also found a lot of variation in terms of the quality of care that's available to people. So it's around training, making sure that all health and social care workers do actually have the training and support they need to deliver quality dementia care. And also there was a patchwork, it was very much a postcode lottery around access. So what we were saying was that everyone with dementia should have a care navigator so that they can access timely, preventative and integrated support in their local area. I also wanted to talk about Dementia-Friendly London. So also in May, which is when Dementia Action Week happens, Sadiq Khan hosted a summit in partnership with us at the Alzheimer Society. So the Mayor of London and the Alzheimer Society. It was held at City Hall, and there was about 120 people came to that summit. And it was a split between half and half service users and carers, and also stakeholders from local government, from health services, from business, and from the arts and cultural sector. And prior to that, we actually consulted people affected by dementia and said, well, what do you want in terms of dementia-friendly London, and what are the kind of key priority areas that you'd want action on in terms of enabling you to live well with dementia? And we came up with this definition that a dementia-friendly London is an inclusive and compassionate city where all Londoners affected by dementia are empowered and supported to live well. And they also identified 5 key areas that were priorities for them. Firstly, it was around travel, so being able to travel to where they wanted to go. Secondly, it was around housing, to be able to live somewhere where they were supported and understood. Thirdly, obviously health and social care. They wanted access to good quality health and social care. Fourthly, in terms of London, it's actually being able to participate in all the arts and culture and leisure activities that happen in and around London. And the last one was around being able to use local high streets and town centres, so just retail. So those were the 5 key areas that were outlined. And Sadiq Khan had this ambition to make London the first capital city in the world to become totally dementia-friendly. So at that summit, he signed this pledge, as did all the leaders who were there in terms of local authorities, health, business, and the arts sector. And so there's now a whole programme of work led by the Mayor of London under this kind of banner of achieving a dementia-friendly London. And we wanted to get to about 500,000 dementia friends, and I'm going to say a bit more about that in a bit, by 2022. About 2,000 organisations to be dementia-friendly. Every London borough working towards becoming dementia-friendly, and I know that's something Bromley's doing at the moment, and involvement of people affected by dementia across every borough and sector. So that's a whole programme of work under the whole kind of dementia-friendly London banner. Let me go with that one. Just to put Bromley in context, in terms of CCG of Bromley, the estimate in terms of people aged over 65, about 4,000 people will have dementia. About 2,800 of those will be diagnosed with dementia. And why diagnosis is important is because that enables people to access the care and support they need, which is about the diagnosis rate in terms of compared to the national is about right. But I thought it was interesting to show you just the London figures, because Bromley is top in terms of people estimated to have dementia, and that's obviously because of the demographic of the borough. But also looking at diagnosis rates. When you look at Bromley in comparison to the rest of London, there is some improvement that could be done in terms of diagnosis rates. The final thing I wanted to cover was Dementia Friends, which I'm hoping some of you will have heard about, which is Dementia Friends is a programme run by the Alzheimer Society, and it's about a social action movement. And what it's about is making sure that people understand our 5 key messages around dementia and commit to taking a dementia-friendly action. And this is done we make dementia friends by having information sessions, which we can come out to you. They happen in a whole host of venues, locations, times. It's only about an hour of your time, and we can come out to team meetings. And it's basically just to make sure that everyone who is front of house or working with people with dementia actually understand a bit more about dementia and how to be dementia friendly. So this particular program is for everyone, whoever they are and wherever they work. And the 5 key messages are these. I've already talked about it's not a natural part of aging, and it's caused by diseases of the brain. It's important to know that dementia is not just about losing your memory. So it can affect your communication, your mobility, your perception, your sequencing. There's a whole range of things that dementia can affect. And also, it's important to remember that there's more to the person than the dementia. So always know that dementia is just a small part of the jigsaw of that person, and everyone is unique. So the point of this Dementia Friends program is to make sure that everyone can be dementia friendly, and that all helps towards creating a dementia friendly community. So if you've not yet participated in the program, come over and see us, and we'll tell you a bit more about how to get involved and how you can have a Dementia Friends session at your venue. And I'm handing over to Nikki now, and she's going to talk you through a bit more about the local services that are on offer.
Hello everyone, I'm Nikki and I'm the Community Development Worker for the Bromley Dementia Support Hub. And I'm aware that I'm on the slot just before the coffee. So if you can bear with me and really concentrate, because it is important. Every 3 minutes here in the UK, a diagnosis of dementia is made. And what we've been doing in Bromley is what we talked about at the beginning, which is having partnership working and early prevention, and it is making an impact. So, who we are? We've just had our 2nd anniversary in July, and it's a partnership working at the bottom. The commission service, the lead organisation is Mindcare Dementia Support, and we have Bromley and Greenwich Age UK and Oxley's NHS, and we're all working under the banner of the Bromley Dementia Support Hub, and it does what it says on the tin. It offers support to not only just the people who have dementia, but equally important, their carers. We have a team, and again, it's made up of different staff from both Age UK and also from Mindcare. And there's 15 people in this team, and we're all really passionate about delivering good quality care to those who have dementia, and also supporting other professionals here in Bromley who are helping us to look after people with dementia. So we want to make partnerships with you. We want you to know about the Bromley Dementia Hub so that you approach us if you have someone, so you can signpost to the hub and you can work with us. I think one of the important things to say is we have all the roles are important and work as one, but the carer support advisor is really important because that's the emotional support that a carer needs, and that's very detailed work that can support the carers. So, who is eligible? Eligibility is clients. So again, it's quite straightforward. People who live and pay their council tax here in Bromley with the formal diagnosis of dementia, and carers who are in Bromley who look after, or a carer who looks after people with dementia who live in Bromley. And now I'm going to sort of throw out the slides. We've had quite a few slides. And I really want to ask you all in the audience really to think about if you had dementia yourselves, if you have a loved one who has dementia, and sadly this may already be the case, or you know of somebody, what would you like the services to be here in Bromley? So I don't know about you, but I would like to have a person-centred approach. I would like to have access to skilled dementia advisors who, when I needed help, I could call the one access number here on our brochure if you haven't seen it. And you can ring, and straight away you actually get triaged. Because a lot of people say that perhaps they want the befriending service. Everybody ticks befriending, it seems. But actually, we need to have our professional assessment. We need the team to see what else you may need, what actually might be more important, and you might not actually need the befriending service, for example. So, again, I know that that's what I would like. I would like my dementia advisors to support me with needs assessment. If needed, I would like a home visit. And I would like to know that they can liaise and work well together with other professionals and other teams. And that was something, again, we talked to at the beginning, because that's going to keep people safe. People who have dementia are more at risk. We want to keep people safe in our community, and we can do that by working closely as professionals. So carers, as I said, the one-to-one, we offer here in Bromley free carers workshops, and that's massive. I want people to know about dementia and what it's like really at the outset, so they don't learn by doing. So that when their partner, who they've been married to for 60 years, wakes up one night with dementia and turns around to his wife and says, "Who are you? Get out my house." We know why that happens now with dementia. And the Dementia Friends programme that Rakshita was talking about, that will prepare people. And there's a lot of information that we can give people at the right stages. We know it's a progressive disease, so it has to be individual. We've heard that everybody presents in a different way. So again, it has to be tailor-made to that individual, to that family, to the needs that they have. So we work, again, very closely with the Bromley Well Adult Carers Service. They now have peer-to-peer support group for carers of looking after people who have dementia. And community. And obviously, as a community development worker, this is really my expertise, my patch. But we work all together because I run the monthly sort of memory, well, it's weekly now, weekly cafe at Community House. We have 43 people per week turning up to join in with our memory cafe. We now have 11 run by different organisations embedded in the community who again offer community support, and that's peer-to-peer support as well as access to sort of safety. And at these cafes we pick up, we can pick up somebody's got a bruise. How did that happen? We can see the carers who are stressed. Other cafe organisers ring up the Dementia Hub and say, "We're worried, we've got permission, we need to tell you about this situation that's happened, that's been brought to our attention." So there's a safety net out there in the community. And that's why we were talking about dementia-friendly hospitals, dementia-friendly high streets, because by taking a 1-hour session and raising your awareness about dementia, what it is and isn't, most people here will have had a medical model of dementia, and that's brilliant, we need that. But there's actually the realities of working and talking to somebody who has dementia, and that's something that the Bromley Dementia Support Hub team and the training that we offer for free to professionals and to people in the community, that's what you can get and pass on, so that we can therefore support people in the community. So that's a high street. We have people walking down the high street who have dementia. There's something called the Herbert Protocol, and again that may be spoken about later on. We launched that at the Bromley Dementia Action Alliance second annual meeting last year, and that's when people with dementia, we know why it happens, and again, if you don't, please come on our training. When people walk out their front door, say it's me, I'm now going to pretend I'm 80 and I could get dementia. Anybody in this room could get dementia. And I'm going to regress in my memories. And this is called the bookcase analogy. And if you haven't heard about that, please come to us and receive some support and training about it, because it explains how your memory works. It explains why you can't remember what you had for breakfast, and you can't remember what you did a week ago and who your daughter is. But you can remember, for example, me, that I'm in my 50s, I regress back, and I think, I've got to get up today. I'm a community development worker, so I'm going to walk out the door in the middle of winter, and I'm going to rush over here to the Warren because I need to deliver a presentation. And the Herbert Protocol is an initiative that will support people and help people, we hope, get back and reunited with their loved ones. So there's a lot of initiatives, and I've only got such a little time that I'm just going to throw you lots of little tidbits, which I hope you will think, yes, there's a little gap here in our knowledge as a team. Perhaps we can invite somebody from the Dementia Hub to come and talk to us. There's 1 hour training or awareness raising sessions. There's a whole day's worth of support around training. And that's given by our Mindcare training team, who are fantastic. And it's also been accredited now. Its certificates are now mapped to the Care Certificate and Dementia Training Standards Framework. And it's sort of understanding dementia. And there's 3 different whole-day courses that you, individuals, or your team can go on. So please come and talk to us at the stand if you want to know more. One of the things that we do, and it's about keeping people safe in the community and in the hospitals as they go about their business, is the cognitive stimulation therapy classes that we run. And Oxley's, our partners, Oxley's, they refer people to the hub team, and our dementia advisors then run a group. It's normally 6 sessions, and it gets people, when you have dementia, you lose confidence quite often, and this enables people to get together, to begin to talk, to begin to get their social skills sort of better, so they are ready as a group to meet at the network of dementia cafes and dementia activities. So we have a dementia choir that meets once a week on a Wednesday, going to be singing at the Glades. So there's a whole community that you may or may not be aware of that's happening right here now at the moment in Bromley. So the one thing, I think it might have already come through, is a raising awareness about dementia. We can all learn more. It's a disease that's progressing. We're learning more about it all the time. So we're talking about safeguarding here. I've mentioned keeping people safe with the Herbert Protocol, but often eating and drinking. Did you know that if you put drinks in a clear cup with water, somebody with dementia who may not have the thirst that other people have, that diminishes, they won't even see it. They need red, blue, colourful utensils, and that can improve what they eat by about 30%. They're really significant information. And again, it's not the medical model, it's how you support somebody who lives and has dementia, and the carers need to know this. There's booklets and things on our table. So one of the things we do in the community also is we work with the Bromley Dementia Action Alliance, and that is to make the borough more dementia friendly. Rakshita, you were talking about that. That's really important, because we just heard that 2/3 of people with the formal diagnosis live in the community. So they are out and about. Sometimes they don't have any other family members looking after them. You'll know this. And that's why I come back to training, because when you really understand what dementia is like for the family and for the person, you cannot make an assessment of anybody who has dementia, really, unless you go out and look at them, or you collect all the information and you work in partnership with their dementia advisors, family members. You cannot speak, because going back to me, if I'd regressed to my 50s, I might be 80 on my own in an awful situation, no food, no heating, dehydrated, medicine piled up. A lovely worker, professional worker, rings up and says, "Oh, Mrs. Fishman, we're a little bit, we're here, we're a little bit concerned about you. There's a bit of anxiety. How are you? And asking some questions just to check. I will think I'm 50. I will think I'm what I am today in my 50s. And I will say, oh, I'm fine. I'm just going to go out. I've got to go and do some shopping. And I will be very plausible because I believe that. That is my reality. So please work with us to raise awareness about dementia, to really understand how, as individuals in your professions, your professional roles, how that's going to impact on what you do. And maybe you can tweak your practice a little bit to be more inclusive and supportive of people with dementia, because one day that could be you or I. And again, if you employ people, and I suspect there's some managers here, it is quite possible that some of your workforce will get the diagnosis. And one thing I want to really stress is we have a tendency, once somebody gets the diagnosis, to go right to end stage. And we forget that there's a lot of living to be done before. And just quickly wanted to mention that language is really important. It was mentioned earlier, we don't talk about people suffering with dementia. They're living with dementia, living with the diagnosis. We don't talk about aggressive behaviour. We talk about distress behaviour because we haven't worked out what that person who has dementia wants. Now, I just want to end on one of our lovely attendees, or guests we call them, who came to and still does comes to our weekly Memory Lane Cafe. So if I could just cue that, please. Thank you.
Malcolm and I met as children, actually. Our parents, or my mother and his mother, met at the baby clinic. So I've known Malcolm really all my life. We actually married in 1955, and life was very good for me. We had a daughter in 1964, and he was extremely good father and a good husband. He was diagnosed with dementia in February 2009. His memory was the thing that went first. That was the first thing I noticed, and why I took him to the doctors in the first case. He suddenly changed from a gentle, quiet man. The first thing I noticed, he suddenly called me a bitch. And I thought, I can't be right. He's never sworn at me in his life. But unfortunately, they change. And he was calling me a bitch and a bastard. He was attacking me, had his hands round my throat at times. He would wake me up at night and want to be taken to the toilet. I would take him to the toilet, pull his pants down, pull his pad down, and then he wouldn't go. He wouldn't go. No, sometimes we were in that toilet 2 hours trying to get him either A, to go to the toilet, or to let me pull his pads up and his trousers up and take him back to bed. It really started an era of bad temper, moods, and it really was quite upsetting. I was really at my wit's end. I felt isolated with him, and somebody recommended me to go along there, and I did. I registered there. I saw the lady that ran that, and we sat at a table, and I was made most welcome. And I have never looked back, because going to that memory place gave me confidence. If I needed any information, there was always somebody there that would help me, give me answers. They'd been through it, maybe, what I was suffering at that stage, and that helped enormously in my and Malcolm's well-being. He would sit there. He wasn't one of these people that wanted the limelight, but he sat there, probably ate the cakes. In fact, they do get a sweet tooth when they have dementia, and it was sort of after the fourth cake you had to sort of stop him. But he did enjoy that, and we spent many happy days going to that cafe. It was extremely nice. I have made lots of friends. One in particular, I think she was the first person that welcomed me there. And because of her kindness, I made sure I sat at her table. And her husband was a little bit more advanced than mine, so she could keep me informed of what to do next, how things changed, and helped me enormously. That's the real sadness that's involved in dementia, that you are so used and so, I don't know what it is, you're just upset that he's turned into this monster, which you know he isn't. He's a nice man. And although people said it's not him, it's the illness, it's still coming out of his mouth, and you still feel that you've let him down, though I know in my heart I haven't, because I've done all I could. With the help of other people. I must admit, the help of the hub has been wonderful, and going to the hub, the meeting every week, has helped me through the system while he was with me, and it's still helping me now to come to terms with his death.
One of the other things that Beryl said at the end is that despite everything that Malcolm and she and the dementia went through, she would do anything to have him back, dementia and all. And that's the reason, I'm getting emotional now, even though I've seen it many times, that's the reason that I'm involved in dementia. I don't even have any family members, luckily, who have dementia, but I'm a nurse by background. And I think, like most of us in this room, we came here, to look after people. And people with dementia are at particular risk. And therefore, as professionals, please support us in the hub and let us also support you. Thank you.